Three addicts, three overdoses, all caught on video. And you got to warn you, it's pretty tough to watch, but keep in mind, everyone survived here. It was a scene last August. This is a Central Florida gas station. Three different people using drugs laced with fentanyl. Again, a drug 100 times more powerful than morphine, and often added to heroin in a deadly mix. Watch and listen as police arrive on the scene and administer the overdose antidote, Narcan.
911, do you need police, fire, medical?
I have three people that are, apparently they seem to be passed out drunk, not waking up in my parking lot. Like, two of them are on the ground.
Yo, bro, wake up. Hey, county deployment. One on him, two on that guy. Wake up.
Come on, bud. Come on, there you go. Wake up, wake up. Roll over.
Again, disturbing scenes, but all three survived. Let's bring in Dr. Daniel Bober, psychiatrist and certified addiction medicine physician. First off, what's your reaction when you see that?
Well, you know, Mike, it's everyday life in America. There's 130 overdose deaths every day. So this is a scene that plays out time and time again. And if you look at the first responders in that video, they're really putting their life on the line. Police officers, paramedics, and firefighters, because even coming into contact with this drug could cause them to stop breathing. So they're really true heroes in this video.
Wow. Man, that sums it up, the danger in all of this. Here's another shocking element. The Narcan used, the amount needed, I think they had to use 3 doses. Listen to the sheriff talk about that. We'll get your take coming out, Doctor.
Typically, when we administer the Narcan, you get that deep breath. You see the results right away, but that didn't happen this time.
All 3 of them had 1 dose of Narcan originally. It still wasn't enough. You know, they needed more treatment.
What do you make of that, Doctor? 1 dose, not enough.
So it's interesting. Between 2012 and 2016, there was a 25% increase in the amount of overdose victims who needed more than 1 dose of Narcan. And the reason is that the Narcan is an opioid blocker that competes for the same site on the receptor than the opioids do. And so as a result, if the opioid effect lasts longer than the effect of the Narcan can wear off fairly quickly and you require multiple doses. And the reason that we're seeing this is because of the addition of fentanyl in drugs like heroin. In 2016, fentanyl surpassed or passed all other opioids as the cause of overdoses. So the fentanyl is causing the brain to forget to breathe, and that's what's causing these deaths.
Wow. So to make it clear, so it's the addition of fentanyl, it's making it more powerful, so you're going to need more Narcan, 2 and 3 doses. That's not out of the norm.
Exactly. And we're seeing fentanyl not only in heroin, we're seeing marijuana laced with fentanyl, we're seeing cocaine laced with fentanyl. So it's a deadly drug, and you just don't know what's out there, but it can have deadly consequences.
Wow. Yeah, we're seeing it. And help us out on the addiction side, the mind of the addict. You know, we talk about it. There is this deadly fentanyl risk, but does that even factor in when someone is an addict and they're just desperate for that next high?
Well, it does, because fentanyl is 100 times stronger than morphine. So people who have tolerance to drugs like oxycodone or heroin, they may not even have the tolerance to fentanyl because it is so powerful. But addiction hijacks the brain. It starts off with casual use, and before you know it, it gets to the point where the brain is basically telling the person, use or die, use or die. They use the drug at the expense and at the detriment of everything else in their lives, their relationships, their work, their physical health. They will put everything aside to get that drug.
Wow. Doctor, thanks again. Dr. Daniel Bober. Appreciate it. And coming up at 2 p.m. Eastern, we'll talk to the sheriff in Seminole County who's